So thanks so much for accepting this invitation. And yes, we are the working group for the Latin American and the Caribbean working group for the G4 Alliance. My name is Viviana Gama. I work for Physicians for Peace as a program director, but currently I am the chair of this working group. Jody and Natalie, if you want to introduce yourselves.
Hi, I'm Jody. I work at Solidarity Bridge. We do surgical training and equipping in Bolivia and in Paraguay. And I helped found this working group. We've been a member of Solidarity Bridge, Solidarity Bridge has been a member of the G4 Alliance for many years, basically since it started. And a couple of years ago, we realized that Latin America and the Caribbean were underrepresented. And so we formed this working group to raise our profile and overall to bring the G4 to the region and to get the voices from the region out. So these monthly speakers, you're part of a monthly speaker series where we invite voices working in the region, and really excited to have young voices, the next generation of surgeons and healthcare providers. Thank you for being here.
And I'm Natalie Scheneman. I'm the Advocacy Associate for the G4 Alliance. And I've been supporting this working group along with our fellow, Alberto, who hopefully is joining today as well. And I'm really looking forward to this presentation. I always love working with InciSioN and getting to know the national working groups and the amazing work that you guys are doing. So thanks so much for joining us today.
And I should mention, I will be doing the interpreting, English to Spanish or Spanish to English, whatever is needed. I am not a professional interpreter, but I do my best, the best I can with simultaneous. So whatever language you're speaking in, I ask you to speak slowly with pauses to help me keep up. Because if you start to speak very fast, it's very easy for me to lose the train, and then it's really hard to catch up. So Bibi will put me in a booth as soon as we're gonna get started, and then everybody's gonna pick if they need translation. Will everybody be speaking in English or some speaking in Spanish?
I think all of them in English, right? Yes.
All of them will be in English.
Okay. So then we'll just do interpretation into Spanish for our Spanish audience.
Yeah.
I think you also all know this will also be recorded, or it's being recorded. Some people, sometimes it's a hard time in Latin America. A lot of people are still working. But some people do watch it later. So just so you know, there will be additional people who will be watching this later. So we really, really appreciate this.
Yeah, that sounds good. Once again, thank you so much for inviting us. We're very excited to be here, and it's lovely to meet you all. Just let me know when we should get started, because I think I'm the moderator, so just let me know and I can start introducing the session, speakers, etc. We have a briefing document which I've shared with Dr. Balmer, so everyone can follow on the session. Let me know if you guys would like the link.
So what kind of document is it? I mean, will slides be presented or?
No, so the document is more to do with the kind of like what goes on behind the scenes, and it's quite useful because if there's different people, you know, what that goes into an event like speakers, panelists, tech support, etc. And something we do within the organization is we have a briefing document that's like centralized, so everyone can keep track of what's going on in the session. So I was thinking as an interpreter, it might be easier for you because you can see the bios that I'll be reading out.
Oh, yes. How would I be able to see that though? Did you send it in a chat?
I can send it in the chat, but then I have to give you access.
Or you
I
could, or email it to me?
I could email it to you, yes. Would you mind sending me your email in the chat, and then I can quickly
Sure.
send it over?
Hello, everybody. More people are joining. Thank you so much.
Hola, Vivi.
Hola,
Hello,
María.
everybody. ¿Qué tal?
¿Cómo estás?
Hello, everyone. Welcome. So
Hello.
glad everyone's here. Welcome to our friends from InciSioN for joining us today.
Hello.
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 And I apologize in advance. I will
Hi.
have to leave the meeting 10 minutes before 5, but I'll see the recording to finish watching the whole thing.
Sure, thank you.
And our partners in Bolivia are in Carnival, so they will also likely going to watch this afterwards, as they said.
Hola, Rubén.
Hola, ¿qué tal? Good to see everybody.
Well, I wish everyone a happy Tuesday today.
So maybe we are going to wait a couple of more minutes and then we can start if that is okay with everybody.
Sounds good.
Natalie, are you going to be the one who's going to open the Spanish channel for Jody, or should I do that? Okay.
I think it should be starting soon.
And does everyone know about the interpretation that you can see along the bottom of the screen? There's a icon that says interpretation. And if you click on that, you can choose to listen in English or Spanish. And if you don't choose English or Spanish, then you hear the speaker in whatever language that speaker speaks in.
Yes, thank you, Ben.
We just came from the organizational meeting of our Francophone working group, which is just getting off the ground. And they're learning a great deal from this team. They're seeking to model a lot of what they want to do after what this group has done over the last year and a half. So the interpretation, the outside speakers, the best practice sharing, all that is just what this group has been doing. So that's exciting to see.
Yes, well, I think we can start for sure. More people are gonna join us. So thanks again for coming. Muchas gracias por asistir a esta reunión. Today we are very fortunate to have the InciSioN group, and we are welcoming them to our speaker series that we are doing every month, like the first Tuesday of the month. Aquellos que quieren ver esta presentación en español, pueden buscar el boot en español, de tal forma que puedan escuchar a Jody con la interpretación al español. For those who are looking for the Spanish version, you can hit the interpretation in Spanish and you are going to hear Jody helping us with the interpretation. So once again, thank you so much, the InciSioN group, for being with us here today. Thank you, Makina, for helping us putting together this wonderful session. Our idea was just to hear the voices from InciSioN group in Latin America. What is happening? What are you doing? What are your efforts in research, in advocacy, and education in your countries? And it is going to be wonderful to hear about all the wonderful things that you are doing in your countries and the collaboration or maybe future collaboration with members of the G4 Alliance in those countries. So Makina, thank you so much. I am gonna give you the word so you can start. And thanks again for those who are gonna be presenting today.
No, thank you so much for the warm intro, Dr. Garma. We're very excited to be here and we're very excited to start. So hi, everyone. I'm Makina Hack. I'll be moderating the session. I'm currently a penultimate year medical student from King's College London. I intercalated in biomedical engineering at Imperial College London. I'm one of the co-chairs for InciSioN this term, and I was previously the 2021 Vice President of Internal Affairs and currently the Permanent Council member at the G4 Alliance representing InciSioN for the first 6 months. So I'm joined by 3 fantastic panelists who are from the Latin American Caribbean region of our national working groups. The first of our speakers is Ms. Leticia Campos. She is a 5th year medical student enrolled at the Universidade de Pernambuco in Brazil. She's currently a member of the 2022 International Teams National Working Group Subteam. She was the 2021 chair of InciSioN Brazil and a member of the 2021 InciSion's International Teams Advocacy Subteam. Furthermore, she works as a leading student with the Brazilian research team that collaborates with the Harvard Medical School's program in global surgery and social change. She is currently the Latin American regional representative within the Association of Women Surgeons Medical Student Committee. Her interests include research methodology and integrity, global health, global surgery, clinical epidemiology, and health equity. The second one of our speakers is Ms. Rhea. She's a 2nd year medical student at St. George's University in Grenada, whose career interests lie within minimally invasive vascular surgery, cardiothoracic surgery, and women's health. Being a woman of color, it is one of her key goals to ensure greater representation within global surgery as a whole. And as the current external president of InciSioN Grenada, she hopes to advocate for the importance of global surgery and surgical equity across all healthcare systems. And finally, we are joined by Mr. Carl Lovaas, who is a 2nd year medical student at St. George's University in Grenada. He's currently serving as their president of internal affairs. He was previously a chemical engineer, and he has ample experience in designing, diagnosing and optimizing various processes, which is a skill set he has found that translates well into medicine. While he was attending St. George's, Carl has started to learn more about international medicine and healthcare, and with this, he's found ways the area can be improved, namely the gap that he sees from country to country when looking at the level of care, well-being, and resources available. And this has led Carl to develop an interest in global surgery and ultimately led him to join the InciSioN family. So today we're hoping to highlight the key activities that have taken place within InciSioN Grenada and InciSioN Brazil as national working groups. So we'll be starting with a brief presentation about these activities, first from Ms. Campos to represent InciSioN Brazil, and then from Ms. Raj and Mr. Lovaas to represent InciSioN Grenada. So Leticia, when you're ready, would you like to start screen sharing?
Just a quick note, if you can speak a little bit slower, so Jody can keep up with the interpretation. Thank you.
No worries.
Absolutely, no problem. I will try my best, I promise. Okay, let me start just organizing a little bit here. Just to confirm, are you guys seeing my screen? Okay, fantastic. I see thumbs up, so I guess this is the confirmation. Okay, amazing. So as I was formally introduced already, I just wanted to add one more piece of information in my bio. Is that today is actually my very first day as a former chair of InciSioN Brazil. And this means that today our national working group is going to start a new chapter in its history. So this meeting has come on the best moment possible for us to reflect on the lessons that we have learned on the last year of InciSioN Brazil, but also the achievements that we were able to accomplish, what we did right this year. So I truly hope that for this presentation, I can give you an overview on where InciSioN Brazil is standing in research, education, and advocacy on global surgery. So let's start with education. So something that we should bear in mind as someone from the global surgery field is that we need to be very critical on the target public that we want to achieve, that we want to aim when producing educational content. And we need to be very aware on the language and the terms that we're going to use to ensure that our audience is going to understand our message. considering that global surgery has most of its literature in English, InciSioN Brazil crossed over a barrier of knowledge translation and knowledge interpretation, since some of our members are not fluent in English. So as a first achievement of ours in terms of education is that this year we had launched the manual on global surgery, or Manual de Cirurgia Global, that is the first ebook in Portuguese that is launched about the DIM. It was made by students from the National Education Team and made by students, but to anyone interested in learning about global surgery. My apologies, is someone with the microphone open? I can hear some background noise. I believe so. Okay, we'll go on. This manual is actually free and open access, available in all of InciSioN Brazil's social media. So to anyone interested in knowing more about global surgery, definitely the place to go is on the manual. As well, in terms of education, one of our aims was also to build capacity in our country. And for these, I can give you lots of examples. So on this slide, you guys can see the amount of the different training sessions that we have provided throughout the year to our over 500 members of InciSioN Brazil. We have provided trainings of 1 hour to 1 hour and a half duration about different soft skills, such as leadership, advocacy, and brainstorming. But we also have provided trainings about research skills that was a demand asked by many of our members. So we provided trainings such as, for example, about writing a manuscript or how to set up a research project. But more than these, we wanted to ensure that we were using active methodologies. So for example, during the sessions, this one was from the advocacy training. We asked for the participants to put on a word cloud what advocacy represented to them. So this is an example on how engaging our sessions can be concerning educational content. Oh well, I've already gave a tip on what is going next with the presentation, research. And last year was very special to our organization because we led our very first research project, and we assessed the Brazilian medical students' awareness about global surgery. And well, we faced many challenges. It was our first project, but we were very successful in it because we obtained responses from over 200 medical schools in Brazil, and this meant over 70% of our medical schools. So we got a very representative sample to our study. And on this study, we found out how many medical students in Brazil know about global surgery, how many would like to learn more about global surgery, the means, the methods to do so, and the main obstacles they notice to follow a global surgery career pathway. So this was a great achievement of ours, our first publication, and well, lots to come still because we're developing more projects at the moment. As well, we also wanted to provide opportunities to highlight the research local champions that we have in our country. So for example, on the image on your left, you can see a screenshot of one of our journal clubs in which 2 of our national research team members presented, that were Gustavo and Igor, and they were involved with the COVID surge study about the timing of surgery following SARS-CoV-2 infection. And they were able to present the main findings of this study, what was the experience of being involved in a multi-centered study, and they were contributing to knowledge to all of our members. And on your right, it is an example that we did not limit this opportunity to national teams, but we also open up for general members. So for example, the article from your right is about the experience of a mentorship program in Latin America and how this mentorship program was being used to enhance gender equity among surgical specialties. And this was written by some of our general members. So this was a way that we encountered to, well, to highlight the very capacitated researchers that we have in our country. And well, about advocacy, that was a really important part of our work last year. And as an example of this, I'm going to share with you what we have done during the 34th Brazilian Surgical Congress. Throughout the event, InciSioN Brazil has launched an online social media campaign in which we entitled as Global Surgery in Brazil. Why do we need this? So more than acknowledging the importance and what is global surgery to the general public, we wanted to take this opportunity as a moment to call to action, to engage with stakeholders. And on this specific Congress, the main stakeholder was the Brazilian College of Surgeons. To enable this, for example, we have drafted a survival guide that contained the most relevant sessions that would cover global surgery related topics and also the key moments of our conference, so members could attend and pay attention. Additionally, every single day of the Congress, we produced content in our social media, and my national executive board did wonderfully. So as examples here, you can see, for example, my national education director, Carolina, my national advocacy director, Sophia, and my vice president for internal affairs, Italo, all of them highlighting the main parts of the sessions and what were the most vital information from that specific day and what to expect on the next couple of days. And as a wrap up of the campaign, we had an Instagram live with Dr. Fabio Botelho, that is one of our mentors and truly a global surgery champion in Brazil. And he could engage with the public and share his knowledge and, well, his experience with us in terms of why global surgery was so important to Brazil and Latin America. Besides this, we did not go through this campaign without collaboration. So we wanted to make a message, to have a joint effort together. And for that, the chairs of InciSioN, Dr. Geoffrey Guzman Laguna and Dr. Catayu Madani, that were the chairs of last year, the chairs of InciSioN Grenada, that is going to present real soon, and some Venezuelan collaborators and me, we have promoted videos explaining why global surgery was important in our countries, in Latin America. And we called stakeholders to action to foster global surgery efforts in our region. And one of the highlights of this conference was that one of our research members, through an activity promoted by another organization, was able to host the very first session in global surgery at the Brazilian Surgical Conference. That was the second surgical conference to host a global surgery session, and we were really delighted to see her presenting, goosebumps all over, I can assure you. And she represented the mission and the vision of our group and also of what global surgery stands for really well. Additionally, after the Congress was done and many ideas were exchanged, we try to combine research and advocacy. And for that, InciSioN Brazil has written 2 editorials, one about the global surgery at national landscape, why global surgery is important for Brazil, where we were standing, and what needed to be done next. So we proposed recommendations on how to foster and develop global surgery in our country and the expectations that we wanted to see in the couple next years. And on the second editorial that was released today, that was great news for me for this presentation. We have collaborated with the Brazilian group of the Gender Equity Initiative in Global Surgery, and we have written the lack of women representation in surgical specialties, the lack of women representation in leadership, and how few women have attended the Brazilian College of Surgeons leadership positions. And we have made some recommendations too on how to engage women surgeons in leadership positions. and also as a combination too of advocacy and education this time. Throughout the year, we have promoted activities related to the Global Surgery Calendar. So for example, activities related to the International Women's Day, Maternal and Health Rights Day, Global Surgery Day, World Anesthesia, and World Trauma Day, in which we had not only surgeons, but anesthesiologists, trauma surgeons, obstetricians, midwifery, nurses, and other professionals joining our activities in order to ensure interprofessionality. Finally, but not least, InciSioN Brazil has also drafted 3 policy documents in which we have proposed commitments to ourselves in what we want to see in the next couple of years, but what we want to claim from other institutions in order to assure development and improvement in some areas that are key in our country for global surgery to thrive. And well, after this presentation, I truly hope that you had an overview on how InciSioN Brazil is doing. I cannot wait to see what the next year is going to have for the next executive board, but I can definitely say by now that the future of the OR is definitely in Brazil. Thank you, obrigada, and gracias.
No, thank you so much for a fantastic presentation, Leticia. And may I say, as someone who had the pleasure of working with you, seeing you as a National Working Group Chair last year, and how you were on the international team, you were an excellent member overall. And InciSioN is certainly lucky to have you. And with that, I'm really excited to introduce our next National Working Group. We have the internal and external president of InciSioN Grenada, Rhea Raj, and Carl Lovaas presenting. Are you guys happy to share your screen?
Yes, let me get that for you. Right. Are you able to see it?
Yes.
Okay.
Hi, everyone. Okay. Carl, will you be introducing us?
If you want me to, I can.
Okay.
Hello, everyone. I know you've already gotten a short bio of Rhea and Rhea and myself. Like how we were introduced, we are from the Grenadian section of InciSioN. And we would like to share with you what the club has been up to and what we plan on doing in the future.
Hi, everyone. Okay, this is our presentation. Yeah. So my name is Rhea Raj, and I'm the external president of InciSioN Grenada. Firstly, I would just like to thank you all for taking the time today to join us, and I hope that everyone is safe and doing well. Can we go on to the next slide, please?
Hello, everyone, again. I'm Carl, and I am the president of Internal Affairs. I was, like stated, I was an engineer, and now I've come to medicine later in life, kind of just followed my passion into medicine, and now learning more about different regions of the world not having the same amount of access. And so that's what really heightened really piqued my interest in this club and the InciSioN family altogether.
And this is our lovely EBoard. We have a Director of Education, Advocacy, Diversity and Inclusion. This is an EBoard position that we included just last year, and Director of Communications, a Treasurer, Event Coordinator, and Director of Research. Okay, I guess now I will start my presentation. So to highlight some of the events InciSioN Grenada has worked on in the past few months, Firstly, one of the most important achievements for InciSioN Grenada was fundraising for a 14-year-old Grenadian boy who has bilateral keratoconus and severe visual impairment who needed surgery. So we held a pool tournament on campus. As you can see in this photo, we held a barbecue night and a Halloween party as well to raise money for this boy. And the fundraisers were a great success, and we managed to collect enough funds for the surgery. And I believe the surgery is scheduled for later this year. And can we go on to the next slide? Thank you, Carl. So as everyone knows, in 2020, things took a bit of a turn, and we've had to shift to holding events and webinars virtually. Zoom has become an integral part of everyone's life, and I don't even remember the last time I've gone a day without using Zoom. So our national working group had to adapt. Since InciSioN Grenada operates within St. George's University, and all of us had to leave the island when coronavirus happened, we've had to hold our events and virtually. And one of them was this interview. So we were lucky enough to have the opportunity to interview Mr. Chidibiri Ibi. He is a self-taught medical illustrator and a medical student, and he's also an aspiring neurosurgeon. I'm sure that you might have seen this viral image that is on the right side. This illustration went viral because people noticed, perhaps for the first time, the lack of representation of dark-skinned individuals in the field of medicine. In the interview, our team discussed the purpose and importance of medical illustrations, and we spoke about his work as a medical illustrator in particular. So we spoke about his cultural approach, which was the approach of embracing human variation, skin tones, hair textures, and diverse facial features, and also his emotional approach, where he tries to portray illness, pain, and really tries to capture the patient's emotions and feelings in all his drawings. We learned a lot from him and his experience, and I believe that this gave us an understanding of what it might feel like to open a medical textbook and not see even one image of someone who looks like us, and how upsetting that might be. The implications of this are felt at a greater level because medical students are not really taught what common skin conditions look like on different skin tones. And this can possibly lead to misdiagnosing an illness or delaying a diagnosis. So I feel like this interview and this discussion really helped us in understanding this. And it was a really, really knowledgeable experience for all of us. Move on, Carl. Thank you.
Okay, and so first off, let me say thank you, Rhea. And one of the projects that InciSioN Grenada started on last semester was creating this platform. We've noticed that other chapters of InciSioN have done this, and we really love this idea of reaching more than just our intermediate followers and listeners. So this was one project that we started on, and with this, I feel like we are now able to get that voice from Grenada out there more and connect to more individuals. And so this was, we started this, and on the screenshot, you can see we started with ethics and global surgery. And what I liked about that is I was on this episode with a couple of my other colleagues, and what we talked about was some of the ethical concerns about how research is conducted. And so you only get the view of countries that are in the higher income countries, as opposed to taking on the perspective of what's going on from everywhere else. And so it really painted a different picture for us to look at and discuss. And that was one thing I felt had a pretty big impact. And so with that episode, now we want to continue. And so continuing on, we do have some guest speakers that we want to bring on, and just those that are doing projects, various projects in Grenada, those just even around the world that have experience in global surgery. Along with this, we would like to do more journal reviews like how we did with ethics and global surgery, and just open the platform for general discussions on global surgery, and kind of leave it at that, and just invite, if someone wants, it has a topic that might not be in an article, or might not, they might not have experience in the field, but they would like to just talk about something they feel is relevant, then we welcome it. And so that was one of the projects that we started last semester, and now we are keeping that momentum and driving it forward. And so along with this and the fundraisers that we've had in the past, a couple of the ones that we are looking forward to. So we have a couple lined up for this semester and following semesters. And so with this, we would like to use the funding for local charities, organization, or I think we were talking to some of the orphanages and retirement homes, and using that money to help the community of Grenada, and as well as surgical supplies. So I know that's one thing that Grenada does lack, and I know that InciSioN Grenada has tried to, or has raised money for this particular cause, but it never seems like enough, is what I'm picking up from articles coming out of Grenada. Surgical supplies is always lacking. And so that was one of the, I guess, avenues that we would like to raise money and put towards that with the island. As well as fundraisers, I know triage workshops is something that we've had in the past, and now as being on the executive board, we've noticed that, and we would like to keep this going and present within our organization. And so what we've done is we are collaborating, or we're going to collaborate with the Emergency Medicine Club, and kind of have just everybody come together and kind of learn and bounce ideas off of each other, and just have it encapsulate everybody. And so that was a couple of things that we would like to move forward with in the near future. And I think that was all of it. If you have any questions for us.
I think we're doing questions at the end.
Okay.
Thank you. Thank you, everyone.
No, thank you so much for such a fantastic presentation. It's so exciting to see what's going on in InciSioN Grenada right now. And historically, you've been one of our more active national working groups. And to see this point that you started when InciSioN Grenada was first set up to where it's in the present day is nothing short of amazing. Thank you so much for presenting. Rhea is right. We will be taking questions at the very end. So now we're going to be moving to our panel discussion. We have about 4 to 5 questions set up. I'll read out who the question is aimed at as well. And if you guys need me to repeat the question, or if your connection lags, let me know. I can repeat it, and I can copy the question into the chat as well. So let me know if you 3 are ready. Do you want to show me a thumbs up? Excellent. Okay, so the first question I've got for you is aimed at Leticia first. What is the current state and development of global surgery in your respective country?
Thanks for the question, Martina. I believe I can answer this question in two ways. When I consider these questions like how is the state of this access to surgery services in Brazil, for example, I guess that the numbers can be quite misleading. The last study that we have here in Brazil showing how the 6 indicators from the Lancet Commission on Global Surgery look like, they are actually very interesting because it would show that Brazil has achieved all the 6 indicators and the expected criteria on each of these. But when you look at the regions, the differences between the regions in Brazil, it is very obvious that we are far from reaching what the Lancet Commission has proposed to the global surgery community. So I believe that now Brazil has done quite a work in terms of universal health coverage. Our health system is public and is free for anyone to access, and it really protects the citizens in terms of catastrophic and impoverishing expenditure. It covers almost 65% of our population for sure, but we still need to work between the imbalances between the regions. I guess this is the first point that I would like to make. And the second point is that we are in the initial stages in terms of having institutions involved in global surgery. We have InciSioN Brazil, for example. We have the Team Brazil that collaborates with the program in global surgery and social change, for example. We have the Brazilian College of Surgeons that has done quite a work, for example, with safe surgery aspect, but we do not see these organizations communicating with one another, collaborating with one another, and making efforts towards a common cause. So I believe that there is still room for collaboration and intersectionality in that sense. So these would be my critical view in terms of how Brazil is going.
No, thank you so much for such an insightful answer. I will direct the same question. What is the current state and development of global surgery in your respective country to Carl, and then Rhea, you can follow with your answer as well.
Thank you. So I am not currently in Grenada right now, but I do know that as the country, we could always be doing better, right? And so even if, things might be looking good, we could always be doing better. We could have more advocacy. We could have more research done. And so what I've noticed is, like I've mentioned with the surgical supplies, that is something that we do need in the state of this current state is surgical supplies. We do need funding for more research in getting this, our perspective and our voice out there. So having more advocacy for us. And so that's what we're hoping as InciSioN Grenada to help bridge this gap between us and the outside world.
Thank you, Carl. So a quick Google search would tell us that global surgery is a term adopted to describe a rapidly developing multidisciplinary field aimed to provide improved surgical care across international health systems. So if I am talking about Grenada in particular, Grenada has a population of approximately 105,000 people, of which 30% live below the poverty line. And there are 3 small private hospitals in Grenada, and the 212-bed General Hospital in St. George's is the main referral hospital. So as Carl said, that there is limited research, finances, and resources, and very poor access to surgical care for most of the population. So it is important for us to expand research, advocacy, and education, the 3 pillars of InciSioN in global surgery in Grenada. And our national working group is a wonderful start to global surgery in Grenada. But we operate within St. George's University specifically, and our strength is limited in numbers due to that. So it is our long-term goal to involve the hospitals in Grenada and doctors or surgeons working there in our mission to expand global surgery. Thank you.
Thank you so much, Rhea and Carl, for that fantastic answer. And following up to that, Rhea, what impact do you foresee that students and early career trainees in global surgery will have in your country?
Thank you, Makina. So I think raising awareness about global surgery is extremely important, and everyone considering a career in the medical field must be aware and exposed to the concept of global health and global surgery early on, possibly in medical school. And that is something we don't see. Not many people know what global surgery is. And loads of members in our club just join our club because they think it's the surgery club. But when we tell them or ask them, okay, do you know what global surgery is? Most of them don't have an idea of what the concept of global surgery is. So for students and trainees in Grenada who are already working to strengthen the concept of global surgery, I think it's had a very positive impact on local communities in Grenada. And one example that particularly stands out is the vaccination and testing camps in Grenada. So medical students at St. George's University volunteered to go to different locations in Grenada and set up COVID-19 vaccination and testing sites. And this project massively helped to increase the number of vaccinated people in Grenada, and early testing and contact tracing also helped in reducing the spread of coronavirus. So that is something that we did and I think really helped. But if more people, more students could be exposed to global surgery early on, I think that more wonderful things could happen and we'd see bigger things happening. So, yeah.
No, thank you so much for your answer. I think it is interesting that people would hear global surgery, particularly students, and just think about the surgery concept and not see how that links to the wider like global health and public health framework. So it's interesting to see that, but it's good that it's at least drawing people in. But I completely agree with you. I think the more exposure we get earlier on, the bigger the impact can be. Leticia, how would you answer that question?
First of all, I believe I agree with Rhea because we are the ones bringing what global surgery is to people who stand in senior positions. We are the ones calling professors, we are the ones calling faculty, administrative staff, and other stakeholders and saying, hey, do you know what global surgery is? So I agree with Rhea on that term about global surgery awareness. And especially in Brazil, I believe that the early career trainees and the students are the talent pool that the country will need in a couple of years. The students and the trainees are bringing ideas of research projects and educational activities that is wonderful to see, because InciSioN Brazil has members in all of the 27 states. From Brazil, and this is quite a lot, we have a diversity background. We have people from different genders, ethnicities, socioeconomic backgrounds that actually are providing the key pieces to understand the puzzle of the differences that rely on the different regions in Brazil, which is absolutely great. So I believe that we have a role in terms of research, of driving the evidence of what we have in global surgery. And I have examples even here on the meeting that have done quite a fantastic job on navigating through the evidence that we have here in Brazil that we need to uncover. But the second thing, and I believe this is on the long-term approach, I believe that the future of the OR will be responsible for the policies. In Brazil, perhaps the most famous NSOP, the National Surgical Obstetric Anesthesia Planning, that we all talk about in the global surgery field and the importance of these. I believe that we are generating the cohort of people that will lead these type of process in our country and making the laws that will contribute somehow to more people having timely, affordable, and safe access to surgery.
A beautifully answered question, I have to say. And I resonate with that heavily as well. I think as we're delving further into global surgery, particularly at the student level, we are starting to look at the wider aspects that make up global surgery as an ecosystem. And within that, yeah, there's policy. Further to that, there's like people are starting to look at medical devices, which is why I'm particularly excited that Carl's answering next, given your background as an engineer. But there's so many more different aspects that make up global surgery that are moving past the concept. And I think it's lovely that that's starting to be seen in our national working groups. So Carl, I've already highlighted a part of your background that I'm hoping you touch on. No pressure, but how would you answer that question?
You're starting to embarrass me now. So one thing that Rhea mentioned, and I've noticed that being a part of this club is that, right, you have a group of students coming in to the club and they're expecting it to be a surgery club. And so, you know, they don't know everything that global surgery deals with or encapsulates. And so what I have noticed is the students coming in is that the willingness to learn and expand their minds of what global surgery is. And with that comes the creativity that of someone from the outside that they can bring in. And I know with the executive board that we have now, some of the ideas that they have just flourished has been, I mean, it's been really great working with all of the students that have come to us. But I mean, it's been a great opportunity, and just I'm excited to see where this Grenada chapter, where it goes. So.
No, I think that's something we're all looking at with every single national working groups. It's going to be really exciting to see where our national working groups are in like the next like even year, let alone like 5-10 years. So following on from that, Carl, what has inspired you to carry out some of the key projects that are going on within your region that you presented on?
So, and I think the idea actually stemmed from Rhea when we were kind of talking about, because last semester I was the director of education, and I was, you know, kind of lost for ideas. I was like, I don't know what to do. I want this club now that we're not coming out of COVID, but now that we are now coming back to the school and we are trying to be as normal again as we can, right? And so I was trying to get ideas of how the club can be more involved, how we can expand our name. And so we ended up coming up with, you know, kind of like what we've seen from the other clubs of this podcast. And I was really embarrassed because I've never done a podcast, and, you know, you hear your voice for the first time and it's terrible. But I think that that's a project I have really grown to love. And I love getting to put our voice out there. And I love getting to talk to people that show interest in, hey, I saw you have a podcast. I have this experience. Let me collaborate with you. And it's just been remarkable. And so that was one of the key things that in our region that I'm really excited to see.
No, thank you for your answer. I think a podcast is great because it's something that's very popular at the moment. So it can connect a lot of different people, whether they already have a long-standing interest in global surgery or if it's a term they're seeing for the first time. So genuinely, congratulations to InciSioN Grenada for thinking of such an innovative idea. I think I've listened to a few episodes of your podcast. It's really good. I know it's very natural to feel nervous about your own voice, but I think everyone sounds very good so far. Rhea, how would you answer that question, considering you're also in the same national working group?
Yeah. So I have been a part of InciSioN Grenada for the last 2 years, and obviously I've interacted with and met so many different people, and we've done a lot of different projects, but the project that is very personal to me and close to my heart were the fundraisers that we held to raise money for the young boy who needed surgery. And I felt attached to the cause because I knew the impact that the surgery could have on his quality of life and his parents too. And I just want to say that, yeah, I've been part of InciSioN for the last 2 years. And in these last 2 years, I've had the opportunity to speak with hundreds of other students from across the globe who share the same vision of working towards global health and global surgery, and mainly surgical equity across healthcare systems. And for that, I'm really, truly grateful to be a part of the InciSioN family.
No, genuinely, we're grateful to have you as part of the InciSioN family as well. I think I met you when I first joined the network as well, which is approximately 2 years ago. I think focusing on fundraising, the fundraising part of your presentation was really touching, specifically because it's such a personal story, and the impact that you must have had on that child must be phenomenal. And I think that is a really good reminder about why we are where we are and what we're trying to achieve. So I completely see why that is something that stood out to you, because it stood out to me when you were presenting earlier, in all honesty. And it was amazing to see. Like, congratulations, genuinely. So finally, moving on to Leticia, what has inspired you to carry out some of the key projects you've had within InciSioN Brazil?
Tough question, I can't say, but I can answer it this way. I am a scientist by heart, which gives me one very important feature. I am bothered and excited when I don't have answers at the same time. Bothered because I don't know what to expect from the information. I don't have any information, but I am excited to discover what is unknown. And then the very first time that I read the Lancet Commission paper on global surgery, I was just enchanted because all of the evidence that was presented made sense to me. I could get the idea that that research was important. It had a local impact, national impact, and global effect. So I was really charmed by the idea, but then I realized, how are things going in Brazil? And I didn't have any answers. For lucky, in July of 2020, I joined the group of InciSioN Brazil that was only composed of 20 people, I guess, maximum only. But we started to work towards a greater vision of the future. And this is what I call that my answer is about transformational leadership, is about creating an inspiring vision of the future, of inspiring others to follow you to achieve this vision, and then to deliver to manage the delivery of this vision, and finally to build up a team to do so. And this is what I wanted to do in InciSioN Brazil. And look at the numbers. Now we have 500 members. This says something. This tells a lot of our work and the strength that Brazil has in the Latin America region. So I guess that would be my answer to this very complicated question.
No, thank you for your answer. And I agree, it is a rather complicated question because it's open to so much interpretation. But as you said earlier, the numbers speak for themselves. Going from 20 to 500 is phenomenal. And it certainly reflects that there is generally a lot of inspiration, not just in Brazil, but within a lot of our national work groups, particularly the Latin American and Caribbean region at this moment in time. So following that on from that, Leticia, what are your key reflections, considering that this is your first day as an immediate past chair of the National Working Group in Brazil? What are your key reflections from your past experience now of overseeing your National Working Group?
First of all, and these I can say wholeheartedly that we have proved this with research, is that social media is a very relevant advocacy tool in terms of engaging people with global surgery. This is the first key lesson. We noticed that when we were engaging people more on our social media, it reflected with members' engagement, more people getting registered, more people getting involved. This is the first thing. And social media can be used for a variety of ways, for advocacy, to educate people, and to promote so many different types of activities. So definitely, this is my first lesson. Social media is the most practical way for medical students and early career trainees to get aware of global surgery and to get involved in the field. This is the first lesson. Second lesson is that we for collaboration. The projects that we were most successful in InciSioN Brazil were the ones that we did not do only by ourselves. When we contact externals, when we contact organizations, or even professionals from other areas that was not medicine. Nurses, midwiferys, for example, have collaborated with us, and they did an amazing job in some of our activities in our organization. So definitely this would be the second thing, be open for collaboration and work with interprofessionality. The third thing is promote research within your organization. Sometimes research projects can take a long time to work out because of the study design, methodology, data collection, then you go into the writing of the manuscript that sometimes can take months. So research projects have more impact in the sense of the evidence that you're generating, but it can take long. But you can also take research and advocacy together and write open editorials, commentaries, blog posts, and interact not only with the academic community, but also with the general public that also needs to be targeted about. So this would be the third lesson. Promote research projects, but also think in more simple articles such as OpenEds. And the fourth lesson is, wherever you go, be a transformational leader. This is going to give you results, and this is going to provide you sustainability of your work. A leader's work is only done when other leaders are formed. This is the lesson that was passed along to me, and this could not be any more true. So this is definitely my fourth lesson, and with this top 4, I go back to you.
Thank you. And thank you for sharing such important lessons that I think are honestly very touching to listen to. And once again, I think this reflects the fantastic performance you've had as a National Working Group Chair. And I congratulate you for that, because I've seen how much InciSioN Brazil was shaped over the year, and it is certainly down to a transformational leader such as yourself. Carl, what are your key reflections from your experiences of overseeing your National Working Group, particularly as a President of Internal Affairs?
So first off, I would like to say I didn't realize that InciSioN Brazil has grown so much, and that is impressive. I love that. So as the President of Internal Affairs and on the EBoard here, that's what we're trying to do. I love your steps. This is what our goal is. And so I think we're working towards that. But one thing that Leticia said that I really love is social media. It is vital now. And thinking back in time, right? Like that was never a thing. And now it's almost like if you want your voice, if you want that advocacy, like she had said, is that you need that. And I think what I appreciate about it the most is that in my role and in my experience with global surgery, I have gathered so much just because of it. I get to see what's happening across the world. And so, that's a big thing for me. And I know that, spreading throughout the population, we're all getting to experience the same thing. As in the current role that I'm in, I am fairly new to the club, but what I have enjoyed is that I have looked over the semesters and over the years of InciSioN Grenada, and I like to see what the club has done and how we can improve and I think my reflections on the club is that, they've been doing a great job so far. And it is kind of intimidating because you get into a role and then you're like, okay, I need to keep this momentum. I need to keep that steam going. And so, no, it's been amazing to see what the club has done. I'm excited to see what we continue to do. But yeah.
No, thank you for sharing your experience of starting as well. And we're really excited overall to see what you guys will be doing anyway. But I think it's safe to say that based on like how InciSioN Grenada has done the past few years and just interacting with you and Rhea in the short time I have full faith it's going to be a fantastic term. And because I've mentioned her, Rhea, would you like to take it away? What are your key reflections? Yours is interesting though, because you've worked in InciSioN Grenada for 2 years, and I believe this is your first year as President of External Affairs. You were also part of the national working group around it, so you would have seen the impact the pandemic has had as well. So with all of that together, what are your key reflections?
Okay, thank you. So being a part of the InciSioN family has changed my perspective of what it means to be a surgeon. A surgeon isn't just someone who cuts you open, fixes you up, and sends you home. The impact that safe and affordable surgical care can have is life-changing. And I'm committed to ensuring that as a future surgeon and as the current external president of InciSioN Grenada, my efforts are focused on this goal. And as the external president, I've had the opportunity to work with work with medical students all across the world. And one project that I worked on was the Global Children's NCDs research collaborative study. And that study, I had the opportunity to talk to so many medical students and learn from them and learn real life lessons that potentially more than what I've learned in classes at medical school. And I'm really grateful for that experience. And as a final note, whenever something feels unattainable, such as providing safe surgical care to everyone in the world, I like to remind myself that a single honeybee makes less than a teaspoon of honey in its lifetime, but along with its fellow workers, they make enough to sustain their hives through the winter, and it's never too late to join the hive. So thank you.
No, thank you, and especially for such beautiful imagery as well. I love that because you've all three of you throughout the panel discussion have touched on such important pillars and core values that we believe in InciSioN. And it's really touching to see because I only see things at the international level, right? I'm not directly part of a national working group at the moment, but to see that you guys are embodying the values that we so proudly uphold at the international level is genuinely very touching, and it's a very special feeling right now. I'm aware that we've gone 2 minutes past the hour mark. Dr. Garma, how are we doing for time? There's been a few additional questions sent in, and I'm just wanting to make sure if we have time to ask those questions, or should we move on and summarize?
Yeah, sure. Please do so. And obviously, if people have to leave, yes. But yeah. Whoever can stay, please, yes, that will be great. Thank you.
Okay, lovely. I'll continue with questions. Thank you to everyone who has messaged in the chat, either directly or into the chat. I've been tracking while people were talking, so we haven't missed anyone. So I believe the first question came after we did the first question in the panel, and it is aimed at Leticia. Leticia, your question is, Brazil is such a large, diverse country, but there are many regions that are far behind others within Brazil. So how is InciSioN Brazil helping to raise awareness of the gaps that are within Brazil, whereas much of the rest of the world is focusing on the gaps that exist between countries rather than within a country?
Wait, I believe this question was quite long. Could you please repeat?
Sure, sorry. And I have a natural habit of talking fast as well, which I realize does not help. Let me try again, and I will speak slower as well. Okay. Brazil is such a large, diverse country, but there are many regions within Brazil that are behind others. So what is InciSioN Brazil doing to help raise awareness of the gaps within Brazil?
Okay, I believe my answer to this question relies on, I believe initially two topics. First thing, are educational and advocacy activities that are provided for members and that are also open to anyone besides members that would like to see, that would like to interact with our content. Most of our activities highlight these differences. We are really aware of the biases and the differences that are between the regions, and we always try to talk about these differences between the regions in our activities. This is the very first thing. And as an example of these, I can mention the Global Surgery Day activity that we have done. There were the challenges of achieving global surgery in Brazil. That was the name of the activity. And all over the panel, we had, for example, speakers from the Southeast, from the South, from the Northeast, and the North of Brazil. So speakers from the 4 different regions. And they were always speaking and sharing their experiences on how the lack of access to surgery impacts their work. So this is one example of activity. And the second thing, InciSioN Brazil has been working with policy documents. One of them is about surgery, obstetrics, trauma, and anesthesia as components of universal health coverage. This is one of our policy documents. And the next term, which is actually the current term because today is the shift, we'll need to work a lot with having a working plan throughout the year to put up indicators to achieve this universal health coverage, the commitments that we want to achieve as InciSioN Brazil. So there is a lot of strategic planning going on concerning these. So this year, we laid the basis. Next year, we go to put our hands on work. I believe that would be it.
No, thank you for your answer. Dr. Ayala, I believe you wanted to ask a question.
Yes, thanks a lot, Makina. I have another feature of OR person right here listening attentively. First of all, it's impossible not to be inspired by you, which is absolutely, so a huge thank you. And I would love to hear your opinions. For those of us who might be nearing 3 decades of trying to get something done and seeing that we're not even close to being where we need to be. From your perspective as leaders, what are we not doing, or what are we not doing enough of that you believe will be of great consequence to advance the global surgery movement, enabling more people to have access?
Thank you, Dr. Ayala, for such an important question. I will leave that to my fantastic National Working Group chairs to answer. When it's a question that's not aimed at anyone, it's first come, first served. So Carl, Rhea, Leticia, if you feel comfortable, feel free to unmute and try to answer that.
I'll take this one.
Go ahead.
So thank you for the question. So it does seem slow, and I think the way that, right, because in a world of advancement, and I heard this the other day, in a microwave society, we want things fast. And I think one thing we need to focus on is, even though it isn't sometimes as quick as we want it to be, the incremental changes, we need to take those small victories. And so we can always continue to work harder and make those increments larger and larger. But I do see how we have and how we are progressing. But you're right, it's, sometimes we wish that it could just be faster. And I'm glad to work with such a great team to where we can be that change. So I hope that, we can help that for everybody.
I believe I can jump in next. Okay. Carl, fantastic answer, I need to say. And also Dr. Ayala, fantastic question. Well, I was considering here 2 points. The very first one is that global surgery needs to learn how to engage with the community. I feel that this is still something that we do not do right, because we generate articles and we read between ourselves as colleagues. We generate huge documents such as the ENSOAPs, and we go through the governments and all the very high level stakeholders, for example. But then we forget to tell a common citizen that does not speak medical vocabulary, because yes, we lose this ability of speaking without medical terms because of medical school, and then goes the training. But we lose the ability to communicate clearly and in a way that people actually understand what are our points. So the very first barrier that I noticed is that people don't understand the concept of global surgery. They think that is about holistic surgery. That is about surgery that goes from the head to the toes. They don't understand initially. So what global surgery actually means, how we can facilitate this knowledge to the patients. And then the second thing is, we do the projects, but we don't consult patients and their families what they would like to see from us. We still don't do the community-driven research projects too. We lack this kind of participation, for example. So I believe this is the first thing. And the second thing is that we need to break the silos between ourselves. Sometimes I only see surgeons talking with surgeons, obstetricians talking with obstetricians, but we don't talk with one another because of the barriers and the stereotypes that we pose into the specialties, and we don't talk between ourselves. These in terms of the medical society. But for example, when we learn about the global surgery or the surgical ecosystem, we consider, for example, that there are biomedical staff, that there are engineers also involved in providing access to surgery. But for example, I have been working 2 years now with global surgery. I have never had a contact with a biomedicine engineer to talk about global surgery, for example. So we are working still in silos, either with the community and the patients or between ourselves. And we need to really break this silo so we can start to understand the common issue and also to do a greater good.
Oh, thank you so much for giving 2 sets of fantastic answers. Rhea, I believe you need to head off right now, and that's fine given we're 12 minutes over, but thank you so much for coming today to present. I know I'm the moderator, but is it okay if I try to answer that question? It's naturally such an inspiring question. So what are you guys not doing enough? First of all, I think you guys are framing that very harshly. There is a lot going on in global surgery right now. And I think something that Carl, you actually touched upon is sometimes we don't celebrate the small wins, or we don't see the wins for what they are. And something that I think I've learned personally, because I actually joined InciSioN by joining the international team straight away. Something that I was taught very early on, which resonated with me, is that it is very small changes that you make at a global level, but because you're never at the national local level, or you're not there specifically in a certain region, you don't actually understand the impact you make when it's happening. It's something that you'll look back on later on in the next few years, and then you'll understand. But while it's going on, you don't actually see it for what it is. You don't understand how it shapes people's lives. You don't understand the direction, but it's something you need to have faith in. But a few lessons that I've sort of seen within the network, and as I've gotten more involved in global surgery, is there are certain things you can do that improve your chance of being able to see and know the impact you're making. One of the things that is so important because of the way we work is communication. We are all based online in different time zones. We come from different cultural backgrounds. We speak in different languages. Communication is key to understanding what is going on in different parts of the world, how that is being perceived, and how we can move forward. Global surgery is, in a sense, such a humanitarian cause. And personally, the reason I think that it has gained so much momentum in the past few years is because the idea of medicine and what a doctor is has also changed. Think about it. Our emphasis on patient interaction is seen as something much more important than it was 20, 30 years historically, when the focus was much more on clinical aptitude and competence. I think as that has happened, when you start seeing the patient as a person, and as a person, you'll always resonate to someone on a human level, you begin to wonder what it's like to access care in one part of the world compared to the other. And that first stemmed, I think, in global health. You think about that in the policy level and public health. So then very naturally, you start thinking about that for surgery, especially for the aspiring surgeons who are seeing their patients as people. Whereas historically, I think you were taught as doctors to see a patient as a patient, to maintain a professional boundary. And the idea and concept of medicine, when that changes, that has an impact much further along. When you think about that, I'm sure when they decided that doctors should be more human, they didn't think it was going to impact every other subspecialty in the field, but it has. So when we're like applying for medical school, we're always taught to put our best foot forward in terms of our communication skills, teamwork, collaboration. These are really key features that you're seeing that are within like global health and humanitarian factors. So to me, it's no surprise that when somebody realizes they want to be a surgeon in medical school, they're finding the idea, the concept of global surgery, something that innately resonates with them, or something they find very quickly, and it's something that you are very touched by. As students, we have more free time compared to our faculty counterparts. And that is reflected in the time and effort that we can put in. So that's why I find that question to be innately unfair, because you guys have done so much. You guys don't realize it. And I think you guys are being very harsh on yourselves, because we are, in many ways, students actually have an advantage, because this is the first time we're coming into medicine. We get to take it all in, and global surgery is already there. But the reason global surgery is already there is because of the faculty from 10, 20, 30 years ago who put their foot forward to actually bring the field up. This is a natural progression. They always say as leaders pass on, they want their successor to be better than they were. And that is simply what's happening, where we are because of what previous faculty and faculty like you have done, we're simply just carrying on the torch. It is a natural progression. It's not something that you compare yourself against. And we need you as much as you need us in many ways. We need you for mentorship, to open opportunities for empowerment. We can give insight, we can give time, we can give our resources, we can come in with a set of experiences that perhaps you don't have, and vice versa. So it really leads back to what these national working group chairs, who are all fantastic, and it's the reason we're so proud of the network we have, is it is about cross collaboration, it is about communication, it's about breaking down silos, and it's about being open-minded. Thank you.
It's amazing feedback. You've been very kind to us, but we take the suggestions of things we should do better. Thank you very much. Just fantastic answers.
No worries. I know we're getting quite along for time. So if that's all right with everyone, if we can just start summarizing the session, and I know you all have very busy schedules. So thank you so much for inviting us today. I think something I wanted to point out was Leticia, Carl, and I know Rhea's had to go. You've both touched upon very important things. And first of all, congratulations for the progress that in each of your respective national working groups. It's a testament to your leadership and your team and the power and the inspiration that you guys have brought. It is something that purely speaks of inspiration and hard work, in all honesty. But one thing I wanted to touch upon, which was interesting, was recurring themes. InciSioN stands on 3 pillars: advocacy, education, and research. Leticia, you've done a fantastic job of highlighting how advocacy and research stand in developing a national work group and where they link. But at the same time, Carl, when you were talking about your podcast series, and Rhea mentioned the fundraising initiatives, that is an excellent testament to the power that education can have. And I think it's a very nice point, because it wasn't explicitly stated when I gave you guys the briefing document. I left it brief, but it is following back to the main things that make up InciSioN. And we're very excited to see what's going to be happening in this part of the world and in our national working groups in the coming future. Thank you so much to everyone who joined us today. Thank you to the Latin American Caribbean Working Group for inviting us in the first place. It's a fantastic speaker series, and we really hope to work with you all soon. Thank you.
Thank you so much, Magdalena. Thank you so much for accepting this invitation. It was truly amazing to hear what is happening in some of the countries of Latin America. So thank you again. Thank you, Leticia, Carl, and Rhea also for sharing with us your work and your experiences in your countries. And thanks again for accepting this invitation. And you are welcome every single time that we have a meeting. You are more than welcome to come and to hear what is happening in Latin America. So, Jody, thank you so much for your interpretation. And everybody, just thank you. Thank you, Dan, Natalie, everybody. So see you next month, the first Tuesday of the next month. We are gonna see each other again. So thank you, Alberto, again. Thank you as well. So have a nice evening. Thank you, everybody.
Thanks, everyone. Thanks, BB. And remember, everyone, we'll have our working group meeting in 2 weeks, 2 weeks from today, same
Right.
time, and we'll start planning future activities like this.
Yes.
Thanks to our
Everybody,
friends
thank you
from
so much.
InciSioN for joining us. Thanks for Jody for interpreting so well. Thanks for Valberto for putting it all together. And thanks for BB for leading our session. And Makina, thank you for chairing it.
Yes. Thank you.
Thank you, everyone. Bye.
Thank you.
Bye.